Most people think that getting a dental implant is as simple as putting a screw in your jaw and adding a tooth on top. But honestly, that's exactly where many patients and even dentists get it wrong. And when things go wrong with implants, they can really go wrong, costing you time, money, and sometimes your smile. Hi, I'm Dr. Wilfred Koon, the principal dentist here at The Point Dental in Melbourne, Australia. Today, I want to share the 10 most common mistakes I see with dental implants and how avoiding them can make the difference between a short-term fix and a lifetime solution. Number 1, forgetting the person behind the smile. Too often, dentists focus only on the teeth and forget about the person that's sitting in the chair. You have got dental fear or you have had bad dental experiences before. Even the thought of surgery can feel terrifying. And I've met many patients who have delayed treatment for years because no one actually took the time to make them feel safe. At The Point Dental, we use sedation when needed. We walk you through every step and we go at your pace because we understand that the emotional side of the treatment is just as important as the technical side. Number 2, treating it as just a screw. Now, an implant isn't just a piece of metal. It's part of your bite, your smile, your confidence. If you only focus on placing the screw and not on how the tooth will look, how it will feel, and how it will function in your everyday life, we've missed the point. So I once saw a patient who had her implant placed perfectly in the bone, but the dentist had not actually checked the space for the crown, and opposing tooth had actually moved into that space, leaving no room to fit a tooth at all. So even though the surgery was technically successful, the patient actually never got the tooth she needed. So for me, surgery is just one part of the journey. The real goal is that you can laugh, you can eat your favorite food, and you can smile without even thinking about your implant. Number 3, overlooking aesthetics. Now, function is important, but so is how the tooth looks. And I've seen implants that work fine, but they look completely unnatural. They're the wrong shape, the wrong color, and the gums just don't sit right in the mouth. And one reason this is happening is because the surgery and the final tooth are often done by different people. So the surgeons might focus only on where the bone is, and the restoring dentist is left trying to make it look right. And more than 15 years ago, before I learned to place implants myself, I actually referred a patient to a surgeon, and the implant was placed where there was the most bone, but not where the tooth actually needed to be. So when it came time to fit the tooth, I had no choice but to make one that wasn't as natural or beautiful as it could have been. So it's the case that I still think about today. That experience was a huge turning point for me. It made me realize that I needed to actually upskill myself and learn every part of the implant process myself, from the planning to the placement to the final tooth. At The Point Dental, all our dentists are trained to always place and restore implants from an aesthetic and functional point of view, so that we plan with the final smile in mind from the very start. Number 4, one size fits all dentistry. Now, everyone's mouth is different. Your bones, your gums, and your bite are unique to you. But some dentists use the same approach for everyone, often planning on it from an x-ray. So the problem is, x-rays are just a guide. They show how much bone there is, but they don't actually tell you the whole story. Now, an implant has to fit not just the bone, but also the surrounding teeth and gums. And we also have to consider how you smile, how heavy your bite is, and whether or not you actually grind your teeth. So for example, if you grind your teeth, you may choose a bigger implant. If your bone is too soft, then we might design the tooth in such a way that it actually takes up less pressure in the future to prevent the implants from getting loose. If an implant is placed too shallow, the gums can recede and expose the metal. Too deep, and you increase the risk of getting gum disease later on. So every patient is unique, and even every areas of the same mouth can be different. And in some cases, an implant isn't the right choice at all, and we'll look at other options instead. So the best results always come when your plan is designed just for you. Number 5, rushing through the process. One of the common mistakes I see in dentists is rushing straight into the surgery. Yes, some cases can be done very quickly and safely, but others need more time to prepare. And the skill is knowing how to tell the difference, and that's where experience matters. If you have healthy gums and strong bone, you might be able to move forward faster. But if there's gum disease, there's bone loss, or other health issues, then we need to fix those things first. It's like building a house. If the foundation is strong, we can build it straight away. But if it's not, you better fix it before you start. Number 6, focusing on brand over skill. Yes, implant brands matter, but a premium brand in the wrong hand can still fail. So it's not just the brand that makes the difference. It's the planning, the execution, and the care after the surgery. So think of it like cooking. The best oven in the world will not make a great meal if the chef doesn't know how to cook. Number 7, not considering your health first. Things like gum disease, diabetes, smoking, certain medication, or even grinding your teeth can affect how well an implant heals. If these aren't checked and managed first, the implant can fail early. So I would rather spend a few extra months getting your mouth healthy than rushing into something that won't last. Number 8, poor communication and expectation setting. Some people are told an implant is quick and simple, and then they are shocked to learn that it can take months to complete. So it's important to understand the pros, the cons, the cost, the success rate, and the risk. And yes, even the fact that implants can fail too. And education is everything. After all, it's a surgery, and it's very important for you to actually understand everything properly. So the more you understand, the more likely you look after your implants, and the better your end results will be. And it's a win-win. Number 9, forgetting about maintenance. A well-placed implant can last decades, but only if you look after it. That means daily cleaning, using the right tool at home, and regular checkups with your dentist. Without this, you risk bone loss, gum problems, and even losing the implants, even if it was placed perfectly. That's why we don't just do the surgery and say goodbye. Our team of oral health therapists will guide you on how to keep your implants healthy for life so that you can enjoy your smile for years to come. Number 10, not using a team approach. Implant dentistry is not a one-man show, and it's certainly not just about the surgeon. At Point Dental, we have the facility, the resources, and the manpower to cater for everything, from the simplest implant to the most complex full mouth reconstruction. Everything is planned to run like a well-oiled machine so that on your day of surgery, everything runs smoothly. That means the surgeon can focus 100% on your surgery without worrying about anything else that's happening around them. That high level of precision and concentration is what gives you the best chance of long-term success. So if you're thinking about dental implants, remember, it's not just about the screw. It's about the planning, the care, the skill, and the follow-up, and making sure you feel safe and confident in every step of the way. So ask many questions, take your time to decide, and seek a second opinion if you are in doubt. And choose a dentist who can see the whole picture and whom you feel comfortable with. So thank you for watching, and if you want more honest conversation about your dental implants, don't forget to like this video and subscribe to our YouTube channel and follow our Facebook and Instagram page. So see you in the next one.